In today's video, let's try to understand about blood pressure. When we measure our blood pressure, we get two readings, right? Upper one and the lower one. Upper one is actually known as systolic blood pressure and the lower one is known as diastolic blood pressure. In the past, doctors used to say that the upper reading, that's the systolic blood pressure, if it's high, it's not so dangerous, but the main danger lies in the lower reading. But no, that's not true. Now, everyone says that both of them are important. Now, let's try to understand what are these two readings. When we measure our blood pressure that is related to our heart, why this apparatus shows us these two readings. See, the upper one, that's the systolic blood pressure. So, it is the pressure created by our heart when it pumps the blood into blood vessels. And the lower one, that is diastolic blood pressure. This is baseline pressure when our heart is in resting phase. So the highest pressure that is applied by our heart to pump the blood is known as systolic, that's the upper one, and the resting pressure is known as diastolic blood pressure, that's the lower reading. Now let's understand why does the upper, that's the systolic blood pressure, it rises. It can be related to the disease, for example, thyroid disease. It can be because of arterial stiffness. It can be because of high cholesterol. It can be because of diabetes. It can be because of heart valve problem. It can be because of kidney issues and it can be because of the age also. And if there is a high spike in high blood pressure, it is dangerous for our life. It can cause angina, it can cause heart attack, it can cause stroke, it can damage the organs, especially kidneys. So yes, it is fatal. And now let's talk about the diastolic. See, what happens is the main concern with diastolic blood pressure is if it's high, it can weaken the main artery of our body that is known as aorta. You can see on the screen that this aorta artery, that's a thick one, it goes through our heart and abdomen and then branches out in many small separate arteries in our leg. And if there is any kind of damage in this artery, this can be very fatal. So both the blood pressures should be normal. We can't say that this is more important, that is more important, because actually both are important. Now let's talk about the mistakes that we generally do when we measure our blood pressure. See, the first mistake is just measuring your blood pressure one time. If you see higher reading, you should be measuring your blood pressure at least 3 times and then take an average value. This will be your blood pressure. Many times I have seen in the patients that in the first reading, it shows 155. Next time when I did, it shows 135. So there is so big difference. So it's always better to measure your blood pressure 3 times and the average of this will be your blood pressure. The second mistake that people generally do is they came rushing towards the hospital or they had a walk or they were in a hurry and they directly go to the doctor. Doctor measures the blood pressure is a little high. Why it is so? Because you've walked fast or you were in a hurry or your body was not calm. That's why it was high. So always rest for about 10 to 15 minutes and then measure your blood pressure. The third mistake is measuring blood pressure above the cloth. If there is a cloth and you will measure above it, then there will be the difference, that's for sure. So always measure blood pressure on the naked arm. This will show accurate reading. And when you measure your blood pressure, your hand should not be lying down. It should be relaxed and straight. You can put it on a table, just relax, sit down, and then measure your blood pressure. Your hand should not hang in the air with the cup. No, it should not be done. This will show wrong readings. So these are small things, but they can create a big impact on your treatment or your line of treatment. So do take care of these things and don't be afraid of measuring your blood pressure. I have few videos on my channel where I have talked about the herbs that can help you to balance your blood pressure. What are the vitamins that can help you in balancing your blood pressure? I'll put the link down below in the description box. You can have a look. So this video was for your information about blood pressure. I hope this video will be helpful for you. See you in the next video with a big smile. Up to the time, smile more, stay happy, stay healthy.